Hello everyone, welcome to D'PAW XPERIENCE, the podcast where we have honest and meaningful conversations about life, health, and challenges people face. I'm your host, Palomoteniola Oluwatishe, and I'm excited to have you here with me today. Today's episodes focus on a topic many women can relate to, but don't talk about openly: cyst or missed periods. Sometimes it can be caused by stress, hormonal changes, lifestyle habits, and even sometimes it can affect us emotionally and physically. And to help us understand this topic better, I am joined by a very special guest of mine,
Star Hadiola by name.
Thank you for coming here today. We're glad to have you.
You're welcome.
And this show is proudly sponsored by FemFlow Plus. Now let's get right into the questions. Star Hadiola, thank you for being here today once again. I have a couple of questions to ask you, and I just want to start by asking you, what exactly is a cyst or missed period? And when exactly should someone start getting worried about it?
So cyst period, medically it is known as a long-term amenorrhea. So it is when your menstrual flow stops for an extended period of time. It is proven medically to be within the range of 3 to 6 months or above. While missed period, on the other hand, is when your menstrual flow doesn't come when you expect it to come.
Okay, so basically you're saying a cyst period is a period that you've missed for a long period of time. Missed period is just something that happens within the range of 1 to 2 weeks.
Maybe when you notice that your period did not come, your period come late, probably 1 to 3 weeks.
Okay. So what would you say, or what do you think someone should do? Like, when should someone start getting worried about it?
Now, occasionally, if you missed your period once in a while, then it is really not that serious.
Okay.
But when you notice that you start missing your period for like 3 months and above, then that is when you need to pay attention to it. When you keep having irregular cycles that are normal, before your menstrual cycles used to be normal. This is when you used to see it. But then repeatedly you keep saying irregular cycles, then you have to pay attention to it.
Thank you so much for explaining that. Do you think stress, lack of sleep, overthinking can really cause a woman's period to suddenly stop?
No, very well, sure.
Yeah.
When a woman is constantly tired, anxious, or when you are emotionally overwhelmed, then your body starts producing cortisol, which is known as stress hormones.
Okay.
So this is now where the issue starts. When you have high cortisol level, then it can interfere with your reproductive hormones, which is your estrogen and your progesterone. And then our brain is deeply connected to our hormones, because there is this small part of our brains called the hypothalamus. It's actually hypothalamus. It regulates our cycles.
That sounds very.
So when you keep having constant stress, it affects that hypothalamus, and it can actually interfere with missed periods, hormonal imbalance. That is when many women notice delay in their periods, maybe during exam periods, when they go through financial stress and serious overthinking.
Okay, so moving on, a lot of women panic when they miss their period. Does this missed period mean pregnancy?
Actually, I like that question because
it's very relatable.
It's very relatable. Most women, actually, realistically speaking, most women believe that pregnancy is the first thing that comes to their mind when they notice missed period. And yes, it's actually one of the most causes of missed periods. So, and we have other factors related to missed periods, which includes stress, hormonal imbalance, PCOS, thyroid issues, among many others.
Now, according to the factors that you said, those hormonal imbalance, how do you think hormonal imbalance, weight changes, can affect the menstrual cycle?
The thing is, our hormones basically control our menstrual cycle. So when our reproductive hormones, which is known to be our estrogen and progesterone, when they are imbalanced in our body, when they are imbalanced in our body, then irregular periods or cyst periods just comes in. It occurs. You start experiencing it. And then for weight changes, if you have excessive weight gain, rapid weight loss, then for lifestyle, if you have poor habits or bad habits, or you do exercise, too much of exercise actually affects our hormones too.
Okay. And it can cause
to missed period.
What are some common signs that a missed period can be linked to an underlying health issue?
The thing is, if you actually have a missed period, does not necessarily mean you have an underlying health issue.
But like I'm asking, what are some common signs? Signs that
if you notice some signs, if your missed period comes with severe acne, extreme fatigue, milky discharge from your breast.
That happens.
It happens, yes, it does. Then we have persistent pelvic pains. If it comes with that, then you could point it to conditions like PCOS. I'm not talking about PCOS. I'd like to chip in something.
Okay.
PCOS has actually been changed. The name is now called PMOS, Polyendocrine Metabolic Syndrome.
Okay. I've always known PCOS to be polycystic ovarian syndrome. So now it is.
So in this 2026, researchers has come together to they noticed that the symptoms actually go beyond cyst problem. So they tend to now come up with another name known as polyendocrine metabolic syndrome. So all the symptoms I mentioned earlier could point to you have PMOS.
Thank you so much for that knowledge. What healthy habits or natural remedies can one do to help or improve the reproductive health?
One thing I would say firstly is proper sleep. I think most women don't sleep enough, because tell me why your body needs, you're feeling that you need to sleep, but then you keep overworking yourself. So I think people really underestimate sleep a lot. So sleep, give yourself that needed sleep. Sleep at least for 7 to 8 hours. Then hydration.
You have to stay hydrated.
You have to stay hydrated, yes. And the only way you can stay hydrated is by drinking enough water.
Yeah, lots of water.
Then we have to balance nutrition. Please eat good and healthy food. This is actually very, very necessary.
Very, very important.
Then your stress management. You have to minimize your stress.
I don't know if that stress can be managed for ladies.
It's actually yeah.
Because
for ladies,
for us, it is like a constant thing. Being stressed, whether from work, from family, from your child, anything, even as a lady itself, that stress, I feel like
everybody goes through stress. So no, let's not be gender biased. Even the men goes through stress. So as a lady, you have to learn how to manage your stress and maintain healthy weight. I'd like to impute something.
Okay.
As a lady too, stop taking random mixtures, because have you noticed that some ladies, when they notice they have missed period, they tend to go to the extreme length of taking dry gins, just because they are scared of what the outcomes will be.
Dry gin?
Am I pregnant? Is it pregnancy? Because they don't want to get pregnant
with that dry gin.
I don't know. They feel whatever it is that is going inside their body.
It will kill it.
Exactly.
Dry gin.
Dry gin. They take different random mixtures please. Our reproductive organs actually needs proper care. Let's give it the care it deserves.
Please, you heard her. Stop taking dry gin whenever you feel you've missed your period and you think it is, what. So last but not the least, Star, at what point should one seek medical attention for a cyst or missed period?
If you notice that your menstrual flow has stopped for over 3 months and above, or you notice irregular cycles, like you keep having repeated irregular cycles, please seek a healthcare professional, because when you diagnose the symptoms earlier, it actually makes treatment easier. Please.
Thank you so much, Star.
Welcome.
And we have come to the end of today's episode. We hope you learned something valuable about cyst or missed period and the importance of paying attention to your reproductive health. A very huge thank you to my guests, Star. Thank you for coming and for sharing your knowledge and insights with us today. And thank you to everyone listening to the D'PAW Experience. We truly appreciate your support. This episode was proudly sponsored by Femflow Plus. If you enjoyed this episode, don't forget to like, subscribe, and share so you don't miss out on another conversation like this. Until next time, don't forget to stay healthy. Don't forget to stay informed and take care of your health. Goodbye.